Hi guys, welcome back to Samuel's YouTube channel, the best place for all things money and medicine. In today's video, we're going to talk directly to second-year PA students, specifically the 4 ways to master a clinical rotation. Speaking from experience as a PA student and as a preceptor to over 80 students, these tips are quick and easy to implement in your rotation, and it's going to give you high impact with great results. So keep on watching if you want to get the most out of your next rotation. So getting right into it with tip number 1, don't get pimped. There is nothing worse than getting pimped by a condescending surgeon. When I was a PA student, there was this one surgeon that would love to pimp the crap out of me every time we walked into that OR. Once he made his first incision, he would start asking me questions like, Sam, what is the most concerning complication for this patient and how do we treat it? And I'd be like, blah, blah, blah. I didn't know what to say. I felt so embarrassed and this killed my self-confidence. And every day for a week, I went home in tears. No, that's a lie, I don't cry. But I did feel horrible about myself because he took every opportunity to jerk me around with questions he knew I wouldn't know the answer to, just to make me feel crappy. To make sure this doesn't happen to you, I'm gonna tell you a strategy that always works. Be the one to ask questions first. Once that surgeon starts cutting, I ask him questions like this. Dr. Chang, what happens if you see an unflamed appendix during appendectomy? Do you still remove it, or do you have to look up the adjacent organs and consider maybe if it's diverticulitis or a perforating colon carcinoma? Like, how common is that? Do you see what I did there? I flipped the switch. I started asking him questions, telling him exactly what I knew and what I needed help with. And when I did that, I noticed he let his guard down. Suddenly, the dynamic of the OR changed. It was no longer a pimping session. It was an educational learning experience. And he talked to me like we were friends, having a normal conversation. And from that point on, the flow of the conversation was much more relaxed. And I felt comfortable asking him questions that I originally thought were stupid questions. But after I did that, he never pimped me again. Because remember, asking those stupid questions now is important. Because I promise you, those are not stupid questions. That is the only way to learn. So don't get pimped. Ask questions first. Tip number 2, get rid of that notebook. You know what I'm talking about. Every single student shows up with a pen and a paper when they walk into a patient's room. They want to jot down every single detail that the patient said so they don't miss any important detail during the oral presentation. So now, what is the problem with that? The problem is you're not listening to your patients. You're too busy doing this, writing. You're not engaging in eye contact and you're not reading their body language. You can't tell if they're lying to you because you are not reading their facial expression. When you're too busy writing or typing, you miss half the diagnosis. Your patient may come to you for diarrhea, but you might miss the underlying cause of anxiety and depression because you can't tell the difference between, no, I'm fine, versus, no, I'm fine. There's a difference. Providers do not walk into a room with a pen and paper. Students do. You will eventually have to leave that notebook behind. So don't get used to it. From day 1 of clinicals, on your first rotation, leave your pen and paper behind. Learn to listen to your patient. Absorb everything you're saying. Imagine having brunch with your best friend. You wouldn't write down everything she's saying, would you? No. You will listen to her story about her miserable job or her recent breakup with her boyfriend. So do the same with your patients. Give them 15 minutes of your time, your undivided attention, and just listen, no writing. Tip number 3, do not take shortcuts on your EMR. Are you guilty of writing short, concise notes and using templates on your rotation? Be honest, because I know a lot of you do this. I see it so many times among my students and it drives me absolutely crazy. Click, 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 click. That is not how you write a note. Students love to write short soap note because it saves time so they can quickly see the next patient. Big mistake. Do not rush the note writing process. You need to master the art of documentation as a student because you don't have the time to learn this skill as a new grad. Practice writing longer, more detailed notes to the point where you can write an entire soap note in less than 5 minutes without the use of a template. Your preceptor can write these short notes because they have years and years of experience and they know how to write a proper note. They know what pertinent information to include or exclude in their notes. And they know to put in their notes where they can avoid a major lawsuit. But you don't have that experience. So as a student, you need to write those long HPIs, describe that complex rash, name all those special ortho tests, and describe a detailed psych exam. I've seen so many new grads who get so fluttered when they have to write a SOAP note from scratch because they don't have a template in front of them. And most of them don't even know how to write a psych mental exam because a lot of time these psych mental exams are not included in the template. So as a result, they waste so much of their time Googling how to write a psych exam. This is poor use of your time. As a new grad, you're going to be thrown into the real world real quick, where you not only have to learn medicine, but you have to learn how to use the EMR, how to consult a specialist, how to fill out FMLA forms, or how to manage all of your tasks. You have a lot of tasks. So the last thing you want to do is worry about how to write a SOAP note. So as a student, use this time to learn how to write better detailed notes. Do not rely on EMR shortcuts. Tip number 4, keep yourself busy. You should never be bored on a rotation. That doesn't mean that some rotations aren't boring. They are. Some days you'll see maybe 5 patients and other day you'll see 35 patients. The point is there's always something to help with or do to stay busy, even if it's studying. When I say stay busy and help, I'm not suggesting you offer to clean the bathroom or do a coffee run. That is not your job, and you don't win brownie points with your preceptor. Actually, I hate when students say that, so don't do that. Instead, take the time to get to know your preceptors and ask questions, medically related questions or questions about the profession. During downtime, many of my students ask me for advice regarding resumes or interviews or student loans because, well, they all know I have a podcast. But even if your preceptor doesn't have a podcast for new grad PAs, it is okay to ask them questions relating to the profession. Ask them about the work-life balance. Ask for advice with salary negotiation, how to obtain free CME credits. Ask them their honest opinion of the company they work for in case you decide you want to apply there later on. It is completely appropriate to ask these types of questions, but be sure you're not crossing the line on matters that may be too personal. Stay away from personal topics. And conversely, don't ever complain about a task that you're asked to do. That is so annoying, and I hate when students do this. It feels like they're ungrateful. Part of being a PA student is getting to know all parts of the job, even the not so glamorous parts. So if they ask you to do something, do it and just smile and don't complain. Unless they really cross the line, then you should report it to your school administration, but otherwise, just do it. I actually have a part 5, 6, 7, 8, but I'm gonna do that in the next video. So that is it for today, guys. Those are my 4 quick tips that's gonna be very effective for killing your clinical rotations. Thanks for tuning in, and don't forget that subscribe button, a like button, and comment below for any more questions. Tell me if you like this type of videos, and I will get more coming to you. That is it. I will see you in the next video. Bye, guys.